Lyme diseases. Lyme disease is an arthropod-borne disease from the spirochetes Borrelia burgdorferi. It results most often in a fever and a rash. Untreated infection can recur as joint pain, cardiac disease, or neurological disease. Etiology. Lyme is transmitted by the deer tick, Ixodes scapularis. The tick is very small, and the bite is most often unnoticed. Only 20% of patients recall the bite of the tick. More often patients recall being outdoors. Many cases will describe the patient as having recently been hiking or camping. The tick must be attached for at least 24 hours in order to transmit the organism. Presentation. Rash is the most common manifestation, occurring in 85% to 90% of patients. It usually occurs 5 to 14 days after, and may occur as much as a month after, the bite of the tick. Fever often accompanies the infection. The proper term for the rash is erythema migrans. It is a round red lesion with a pale area in the center. The lesion resembles a target or bull's eye. The knee is the most commonly affected joint in Lyme disease. Joint pain is the most common long-term manifestation. 60% of those without treatment will develop the joint pain. It is an oligoarthritis, which literally means that a few joints are affected. Joint fluid will have about 25,000 WBCs per microliter. This would not distinguish it from other causes of joint inflammation or infection. Seventh cranial nerve or Bell palsy is the most common neurological manifestation of Lyme disease. Neurological manifestations occur in 10% to 15% of patients. They may present with symptoms of the CNS or peripheral nervous system such as meningitis, encephalitis, or cranial nerve palsy. Cardiac manifestations occur in 4% to 10% of patients. They present with damage to any part of the myocardium or pericardium such as myocarditis or ventricular arrhythmia. Transient AV block is the most common cardiac manifestation in Lyme disease. Diagnostic tests. If the lesion is typical, a rash consistent with Lyme does not need confirmatory testing with serology in order to initiate treatment. Serologic testing for Lyme is essential for all the other manifestations such as the joint, neurologic, and cardiac manifestations. Since most causes of seventh cranial nerve palsy, arthralgia, and AV block are not caused by Lyme. Testing is with IgM, IgG, ELISA, Western blot, and PCR testing. Treatment. Asymptomatic tick bite _________ no treatment routinely. Rash ________ doxycycline amoxicillin or cefuroxime. Joint. Seventh cranial nerve palsy doxycycline amoxicillin or cefuroxime. Cardiac and neurologic manifestations other than the seventh cranial nerve palsy intravenous ceftriaxone. Asymptomatic tick bite. Most patients with tick bite, but no symptoms of Lyme, do not need prophylactic treatment. A single dose of doxycycline is indicated within 72 hours of tick bite when Ixodes scapularis clearly identified as the tick causing the bite, tick attached for longer than 24 to 48 hours, engorged nymph stage tick endemic area.